Okay. All right. So our introductions. All of these people aren't necessarily on the call, but I wanted to introduce you to who our team is. We have Dr. Erin Salibi. She's our Director of Women's Health Programs and Innovations. We have Mariah Moini, who's our Program Director, specifically of Mama's Neighborhood, that portion of the program. Danelle Peters is our nurse practitioner, and she pretty much handles everything related to Mama's Neighborhood that's in the clinic, on the clinic aspect side of things. We also have Dr. Ashaki Jackson. Ashaki handles all of our data, a lot of our reporting. She's our research and evaluation portfolio manager. And then there's me. Like I said, I'm one of our health educators, and I manage a program that's called Baby Boutique, and I'll tell you a little bit about that as we move further through the presentation.
And I'm sorry if I could just interrupt. I forgot to mention at the beginning if everybody could just mute your phones. I don't have everyone muted now. Sometimes we do get a lot of background noise, so I could mute everyone if we have issues with feedback or background noise. But if we could just try everybody muting yourself. If you don't have a mute function on your phone, you can use *6 to mute and then *6 to unmute. But we ask that you please do not put us on hold because we'll hear the hospital's music. All right. Thanks very much. I'll let you get on. Sorry for the interruption.
Oh, no, you're fine. You're fine. So, I wanted to tell you guys a little bit about Mama's Neighborhood, but I wanted you guys to understand when we say women's health programs and innovations. So our program, I keep referring to it as Women's Health Programs and Innovations because that is the program that we are under and we work within under Los Angeles County Department of Health Services. Mama's Neighborhood are the program that you guys are familiar with in reference to Mama's Neighborhood is a component of women's health programs and innovations that deals with pregnancy, pregnant women. Our women's health programs and innovations, which I will affectionately call WHOOPie, that's what we refer to it as the acronym. We provide all of the women's health services across Los Angeles County in the clinics and in the hospitals. So that's women's health, whether it be pap smears, our mammograms, our cervical type testing, any of those type services for women outside of childbearing age, whatever that falls into, that's who we are. So Mamas is the portion of our program that deals with pregnancy. So in April of 2013, our department, Los Angeles County Department of Health Services, and WHOOPie, they established a new strategic platform of comprehensive, coordinated care with their families. And this program was funded through the Centers for Medicare and Medicaid Services, and its focus was to improve pregnancy and birth outcomes. We address social determinants, and we address those determinants to see the impact rate of preterm births and low birth weight. So we want to make sure that we address those issues. MAMAS is an acronym, as you see it on the side. What it stands for is Maternity Assessment, Management Access, and Service Synergy throughout the neighborhood for health. So MAMAS is definitely the acronym that you want to refer to because it's a lot shorter, but we want to make sure that you understand what that means. So as I refer to our program as Women's Health Programs and Innovations, who we are a comprehensive women's health services that include well women care, prenatal care, family planning, specialized obstetrics and gynecology services. We also deal with primary prevention. And as I stated previously, all of our services are provided to women of all ages and all stages in life. For our model and care domains, if you look at the circle and if you walked away with understanding nothing else, if you look at the bottom portion of the circle, the mother is at the center of all the other circles that you see. So here in our program with Mama's Neighborhood, our mothers, our patients are definitely the center of our focus. Around them, we know that you built the family, and around that, we have Mama's neighborhood. Now, our neighborhood consists of not only families and mothers that are within that circle, but that also consists of a lot of our community agencies that we have outside partnerships with. So once it is that we see patients, and if it is that they are in need of other types of related services and social type support, we're able to refer out. We're able to get them information and assistance from food banks and our legal like type services and or support with child care, whatever it is that the service may be. Outside of that circle, we have mother centered policies that govern our program and how it is that we conduct.
I'm sorry, can you move the slide down so we can see the circle?
The circle, move it down?
Yeah, we're not seeing the slide.
I think we're on slide 3, but it looks like slide 5 is the one with the circle, right?
Yes.
Okay.
So do you see the circle?
Perfect.
Oh,
Okay.
no, there's 25. Never mind, there's 25. When it's the 202, that's what I thought it was, but no, it's 200.
Okay, I'm going to actually mute everybody real quick here because we do hear some background noise. And then, Brandi, I'm going to unmute you here real quick.
Okay.
Sorry. Okay, so yeah, everybody is muted. If you do have a question, maybe I'm muted too, am I? Oh, okay. Yeah, if you do have a question, just feel free to type it into the chat box. We will get to questions, but I'm just going to mute everyone for now just to cut out the background noise. Okay, thank you. All right, Brandi, you should be unmuted, but I don't hear you. All right, Brandi, are you there? All right.
Hello? Now, I heard that I was unmuted.
Okay.
Can you see?
Yes. Yeah, we can
Okay.
hear you.
All
Great.
right.
Sorry. Thanks.
So that's okay. I don't know what last part you heard, but I will address the care domains that we have. So as part of our program, our care domains fall under substance use, social support, mental health, and biomedical risk. Okay. All right. So our maternal-centered medical home, the concept that we have here with the maternity home is for all of the services that a patient receives to be in-house, for them to be able to have a one-stop shop place that they can go for care. All right, so if a person comes to our facility, they register with DHS as their maternity home. And initially, there's an assessment that's done in the clinic with the patient to identify their different strengths and areas of improvement that may be needed, some of which will include a PHQ-9 that they give patients to address issues that they may be having with depression. And they also will give them another test that's called a GAT-7, and that has to deal with anxiety. So both of those can help measure some of the risks that they have or that they present with. So we have multidisciplinary teams of clinical and social care professionals that coordinate care, and they also connect and link patients with the neighborhood network and various pathways to care. So what that would look like is a patient would come in, they enroll in our program, They'd have a care coordinator that follows them throughout their pregnancy while it is that they're in the clinic. They're connected to medical providers to receive care in the clinic or hospital where they're receiving services. They have access to social workers. They have access to mental health type support teams to offer services to them. And that's all while it is that they're coming to our various facilities. We do use evidence-based measures and quality indicators to aid in continuous quality and improvement activities. And our electronic health records that we have here through LA County are very useful. We have a system that's called ORCID. And now with ORCID, all of our county facilities are able to talk to one another using the same system. So if a patient is receiving services at Harbor UCLA Medical Center and a doctor is trying to get a message to one of the health educators that teaches the classes, we can access that information through ORCID. Everybody can talk to one another. And if it is that it's a patient receiving services at LAC USC Medical Center and they have to go to Harbor for something, that same system has all of their electronic health records in it. So we can all talk to and communicate a little bit more seamlessly with one another. When it is that they come to these medical centered homes, we impanel our mothers. So that means they're assigned to a specific facility. They're assigned to a specific doctor or team that's going to provide their care and help with the continuity of their care. We offer proactive clinical and social care teams that honor the perinatal period, and we definitely recognize that it is a critical window for the intervention and improvement of services, of care, and it's definitely a special time for mothers and families. I went into a little bit of who our team consisted of, but again, I'll reiterate that we have our care coordinators, maternity mental health providers, social workers, health educators, we have our doctors, our nurses, our nutritionists, we have community-based organization and agencies that are part of our team, and included in that is the patient as well. The services that we provide through Mama's Neighborhood, we offer prenatal education and resiliency classes. Fathers are included in that and definitely welcome to join and participate in those classes. We offer housing assistance, WIC and other food services, substance use and treatment, childhood education resources, hospital tours. A lot of our patients are may unsure about delivering at some of our county facilities, and they're eager to see what the L&D floor looks like and what their rooms would look like, what their beds would look like. So each of our sites has hospital tours that are conducted that the patients are able to participate in. We have pediatrics and well women care. The program that we had was called Mobile Mama. And what that was, it was a program where it was that patients were able to go to different agencies that participated with us and were partnered with us. And there was a number in the window where they could text on their phone and share information as to how that resource helped them and if they were pleased with their resource. So it was the use of technology and them kind of rating the services that they were seeing. We have family planning, and we have our Mama's visits, our home visits, that are also a part of Mama's Neighborhood. So who is eligible? Patients that are enrolled with Los Angeles County Department of Health Services are eligible to receive services through Mama's Neighborhood. Patients receive services through their pregnancy period and up to 10 weeks postpartum. And once it is that they reach their 10-week postpartum time frame, we work to connect them with women's health providers and pediatricians to continue that medical care that they're receiving in our facilities. Something to note that we used to, when it was in 2013 that Mama's Neighborhood started, we were started on a grant, a Strong Start grant, and that grant has since disappeared and gone away. So we were able to prove that our services were effective, and now the services that patients receive through Mama's Neighborhood are part of a standard of care. So now it's more so that when patients come to our facilities, they provide their consent, they still have assessments that are done, but they actually have to opt out as opposed to opting in. It's now part of the standard of care at our hospital facilities. All right, so just to share some of the data with you, we're in the process of updating numbers. But with our data that we have currently, age group-wise, although we see patients across the gamut, over half of the patients that were enrolled were between the ages of 20 to 29 years of age. And we have, I hope it's clear on the screen, so 25 to 29 years of age was a close second at 26%. A lot of times we're asked about our less than 15 years of age. We do service adolescents as long as they're pregnant and they're coming to our facilities. They're also able to utilize the services that we provide. If we look at race and the breakdown of race, with this population that we surveyed, most did not disclose their race. So that was 49% that really didn't disclose. And that's where our biggest quantity was. But about 1/5 of the patients, like 21%, identified as white or Caucasian, and about 1/5 or 20% identified as Black. In reference to ethnicity, with this sample that we have, close to 2/3 describe their ethnicity as Hispanic or Latino, and the rest of the 37% identified as other, non-Hispanic. So in reference to gestational age at intake, so the gestational age, when it is that we have patients enrolling in our program, about 2/3 or 65% of those patients enrolled, they were enrolled during their first trimester. And we do have patients that enroll at various trimesters and various weeks in pregnancy. But for this population, 65% enrolled in the first trimester. With our clinical risk factors, as you can see, having an unintended pregnancy, patients self-reported that about 57% of their pregnancies were unplanned or unintended, and 31% of patients reported that this was their first pregnancy. And after that, the 18%, that red bar toward the bottom, indicates our patients who had a maternal age that was greater than 35. So when we look at our referrals that we assess in reference to the needs that our patients have, we definitely have a lot of services across the gamut that are needed. But in reference to this graph, about 81% of patients wanted WIC-related services. 63% of those patients attended our prenatal education and resiliency classes. And in the third highest category, it was breastfeeding assistance that was requested. Other services included nutrition counseling, oral health, parenting, any type of emergency needs, different types of treatment services, intimate partner violence or domestic violence, mental health, housing services, food stamps, food banks, job training, and our GED education, and transportation related services. So to date, if we look at some of the different things that our program has been able to accomplish and our offer, we are upgrading sites for improved patient experiences. Our comprehensive intake and assessment process and procedure has gotten much better, and we're able to capture more information for patients to better tailor the care that they see and that they receive. Our individual care plans for patients are done in a way that's designed to best address their needs. We have our warm in-house handoffs in addition to our handoffs that we do for the community. Our continuity of coordinated care has definitely gotten better and improved. Breastfeeding support, our directories for referrals, our Mama's Mobile program. Our prenatal classes have been revamped for the education portion and the resiliency skills that patients receive. We've also improved and increased and expanded our baby boutique program, and our Mama's Visits program is now a part of Mama's Neighborhood. So I mentioned a little bit about a program that was called Baby Boutique, and these are a few photos of what Baby Boutique is. We're able to receive outside donations from agencies that provide us with items for redistribution to the patients in LA County who are receiving services through our program who may be in need. So Baby Boutique was created and developed by Women's Health Programs and Innovations with LA County to improve pregnancy and birth outcomes across Los Angeles County. It's designed to help growing families obtain the items that they need to definitely help give their children a healthier start in life. The agencies that donate items to us are Baby to Baby and Good Plus Foundation. And these items are redistributed to patients at various times throughout their pregnancy and postpartum periods. It starts at intake, and patients receive items through the clinic and hospital. They receive items through our Mama's Visits program, and they also receive items through our prenatal and education and resiliency classes. Our classes are taught for 8 weeks at a time. We tackle different subjects each week, and the classes are about maybe 2.5 hours, 1 day a week. Our fast track classes are designed for those families who are not able to participate in the 8-week session. Those classes are taught over the course of 2 days for 2 weeks, and they are 4 hours apiece. So patients are still able to get the information that they need. So these are a few pictures of what it is that our neighborhood looks like. Some of the items that we've been able to redistribute to our patients, from strollers to car seats to cribs, high chairs, swings, diapers, clothes, you name it, we've had an opportunity to get it for our patients. Our locations are currently Harbor UCLA Medical Center, LACU SC Medical Center, Olive View UCLA Medical Center, Bellflower Health Center, El Monte Comprehensive Health Center, Martin Luther King Outpatient Center, Hubert Humphrey Comprehensive Health Center, Wilmington Health Center, and Long Beach Comprehensive Health Center. And our services continue to expand. So In reference to psychosocial risk factors that patients expressed having are risk factors that they were dealing with, that they were requesting help with from our program. We have about 56% of our population that reported being underemployed or unemployed. Following that, we had about 54% of our population that mentioned job training, assistance with DCFS, DPSS, and immigration type related services and help. At least about a third of our patients have needs in the areas where they may be unmarried or saying that they wish that they had more support from a partner. And about a quarter of the needs related to housing. And about a fifth, we would say roughly about 19%, reported that they needed help with emergency food related services, and roughly 18% expressed there being a language barrier issue. So for our pregnancy outcomes, when it comes to gestational birth, for about 702 patients, we have most of our patients birthing at full term, or at least 39 to 40 weeks, and about 5% preterm and very preterm. So our program does do a lot to try to capture patients at a certain time in their pregnancy to be able to work with them and or work with them whenever it is that they present. So it is that we can help with assisting them to have the healthiest birth outcomes as possible. In reference to our pregnancy outcomes and reporting for newborn weight, we have our normal weight in green being about 86% of newborns that weigh within this category for the majority. So we're proud of the work that we're doing, but we see with some of the other slits in the pie that there's definitely more work that needs to be done. So, since you guys are outreach workers, if it is that you are interested in referring patients to us, in order to refer a patient, I've listed a secure website for you to visit. You would visit that link. It would take you to the page where you could refer your patients online directly. If you had any type of programmatic questions, like regarding partnership, outreach, education, or just want more information about the program, we have our email address available, and you can also always call the number that's listed. So that's how it is that you'd refer a patient to Mama's Neighborhood, and a little bit of information about the services that we provide. Okay, so now that was probably more so the Mama's Neighborhood program that you knew or were familiar with. What I'm going to talk to you guys now about is our Mama's Visits portion of our program. So all of the information that I presented previously was related to our Mama's Neighborhood program and our clinics, which is our umbrella program of services. With Los Angeles County, I don't know how many of you are familiar, but we have a program that's called Whole Person Care Los Angeles. And Whole Person Care, their aim is to deliver seamless coordinated services to LA County's most vulnerable populations, or Medi-Cal beneficiaries. So a lot of these patients are high risk and they're high utilizers for the emergency departments. So what WPC LA Care has done is they've brought together, through social service agencies, through various systems, they're providing the following types of resources and support. So they're dealing with homelessness, they're addressing justice involvement, serious mental health, substance use disorders, complex health conditions, and barriers to healthy pregnancy or health and pregnancy. I implemented this slide because I wanted to explain to you how our Mama's Visits portion of our program is really a part of whole person care, and it's just one small component. We deal with the pregnancy component. So the biggest picture, what whole person care services is doing is they're providing resources and support that are needed to thrive in these following areas, whether it be food or legal services, housing, education, family, employment, money, and health. And I also listed the link. If you'd like to find out more about their program as a whole, you can visit that link. So, as I said, through whole person care and their pregnancy arm that deals with high risk pregnancies, this is where Mama's Visits came about. So, Mama's Visits is actually under the umbrella of Mama's Neighborhood. It's just an extension of services. So, where Mama's Neighborhood that you heard about previously is solely in the clinic, our Mama's Visits is the portion of our program that allows us to get out into the community, provide home visitation type related services and support. We provide support to pregnant and parenting mothers that are either currently incarcerated or recently released. And the agencies that we work through is the Century Regional Detention Center, which is known as the jail or the women's jail that our women are currently housed in. Usually when they have to deliver their babies, they deliver at LAC USC Medical Center. And if they have not been released, they go back to CRDS until it is that they're released. The Office of Diversion and Reentry is the office that works with them upon release with placing them into systems or making the transition more of a smooth process for them. And they may have homes that they go to, or they may have jobs that they're working with in order to get women employed. So these are the two agencies that we're working with as well. So our program is currently in the jails. We provide health education to our women in the jails. And upon release, we're working with them as well. So we have mobile care teams that provide coordinated and compassionate services to our moms. And those mobile care teams consist of public health nurses, they consist of care coordinators, and they also consist of various social workers, clinical and psychiatric social workers that are able to provide a lot of the mental health related support services. What they do is when it is that they identify a patient as being eligible for the program, usually our care coordinators or public health nurses, patients will have a PHQ-9 assessment and a GAT-7 assessment done at the time to see what it is that their needs are at that time. If it is that the nurse feels as though mental health is something that the patient needs more so readily, then they'll send the psychiatric social workers to go first. The team doesn't really necessarily tag team patients, meaning all three go at the same time, but they provide different visits at different times of the month as needed. So there's really no set number of visits as to how our MCT care team can provide services. It's just based upon the need of the patient for the duration of the time that the patient is in the program. Our care management is personalized to support low-income, pregnant, and parenting mothers with different complex, stressful life-related issues. Now, this is a portion that gets a little bit confusing, so I'm going to try to explain it as best I can. For Mama's Visits, patients can receive services up to 18 months of the time of being enrollment. So what this means is usually when it is that you are in mama's visits, at the time of your enrollment, your countdown for your 18-month time frame would start, and it would be based upon the needs of the client or patient at that time. Usually, people participate in our Mama's Visits program from 12 months to 18 months. We provide visitation services, as I said, for the mother and the child, and we usually see the child until the child is up to a year old, and the services can extend. Somebody had a question?
It looks like maybe this is the next slide. Is this slide 26? Well, we're just seeing slide 25.
Is this the one?
Great. Yeah, that's Mama's Visits, right? Yeah, perfect.
Okay, yeah. Okay.
Great, thanks a lot.
Okay, and our focus is the focus on preterm birth reduction. So this is a little bit encompassing of what Mama's Visits actually is. Okay, so our Mama's Visits teams and services, I've gone into who our team consists of, but the services we provide, like I said, we provide home or community-based care and support services. Our linkages, our prenatal care linkages with a doctor at a mama's clinic, or birth planning for moms that want to deliver at one of our hospitals. We also provide family planning education and support, and linked connection to advanced health services, meaning psychiatry, substance use support, violence, counseling, high-risk doctors. We provide all of those connections to our clients and patients that we serve. From our services that are continued, educational guidance, our group educational classes, and our community referrals are definitely something that's continued and extended within this program. So our educational guidance, we have our healthy pregnancies, recovery after birth, baby attachment and development, mothers meetup socials to celebrate motherhood and build family and camaraderie with mothers, family planning education. We also address pregnancy, stress reduction, breastfeeding, parenting, and bonding. And our referrals continue with WIC, housing, jobs, training. We have patients that would like help with enrolling in school, our child care, legal support, and transportation-related services. The curriculum that we use for our home visitation program is Partners for a Healthy Baby. The curriculum was created through Florida State University through their Center for Prevention and Early Intervention policy program. It's a research and evidence-based home visitation curriculum. The series includes 4 books. Those books are the books that our nurses, our care coordinators, our psychiatric social workers, anybody that's providing services to families utilizes this curricula to design personalized care plans for patients, and it helps direct whatever education that patients receive when it is that they are doing their visits. Sometimes patients ask for specific information, while other times what's shared is based on what the patient's needs are. But although we service all service planning areas across LA County 1 through 8, and our teams are varied throughout the county, our curriculum is used to fidelity everywhere. So when it comes to eligibility for Mama's Visits, this is a summation of kind of like what we're looking for. So we're looking for patients or clients who are pregnant who have recently delivered. So usually for mama's visits, although it's case-by-case basis, you can enroll in mama's visits up to 3 months postpartum. You have to be Medi-Cal eligible or low income. You have to be an LA County resident. So we often sometimes get questions from clients that live in Orange County or close to the LA County Orange County border. We can only service LA County residents. If patients are experiencing complex or stressful life circumstances, they're eligible. If they're identified as medically complex through an interview process, meaning they have a lot of different issues, they're eligible. If they experience any of the following indicators of preterm birth risk, history of miscarriage, high blood pressure, drug use, or their level 2 or 3 global risk scores after it is that they complete a perinatal service intake, including African American heritage, they definitely are eligible for the program. Our referral process is very similar to Mama's Neighborhood. Mama's Neighborhood Clinic is the overarching umbrella as to where Mama's Visits falls under. If you would like to refer any patients to Mama's Visits, you'd go through the same process as you would if you'd like to refer them to Mama's Neighborhood. They would be assessed and they would be placed in the program at the time they would be most beneficial for them at that time. Where we are located with Mama's Visits, pretty similar to where we are with Mama's Clinic related services, just in addition to servicing all of the service planning areas across SPAs 1 through 8. So our program caters to patients in all of them, everywhere from Lancaster and Antelope Valley all the way down to San Pedro.
Hey, Brandi.
Yes.
Just going back to eligibility, there was a quick question asking if a client qualifies if she has an open DCFS case. Are they eligible with open DCFS cases?
Open DCFS cases, I'm not sure. I don't know that would exclude them, but I can definitely take the question down, and if there are any other questions like that, get them answered specifically. But we haven't heard, I haven't heard at least, that excludes them from participating in any of our services. Mm-hmm. Okay. All right. So what it is that our program has done, we have 4 health educators that work for our program, and we are spread across LA County. So Carla Brito, if any of your patients or clients or your hospital facilities reside in SPAs 1 and 2, she's going to be your contact that you would reach out to directly. If it is that your hospital areas reside in SPAs 3 and 4, you would reach out to me, and I would be the person that would be helping you to navigate through the system. If it is that you reside in SPAs 6 and 7, or your hospitals fall within those areas, the health educator that would be working with you is Eunice Soriano, and her contact information appears here. And if you are in SPAs 7 or 8, Angelica and Eunice share SPA 7. But if your hospitals are in those regions, this is the health educator that you'd reach out to directly. And if you have any clients that need services in SPA 5, we all share that region. So you could call any one of us for that. So do you guys have any questions?
All right, why don't I try unmuting everyone for questions. Of course, the chat box is always open. If anybody has any questions there, you can type them. But I am going to unmute everybody, so if you're having a side conversation, just heads up. Okay, so everybody should be unmuted. If you wanted to ask a question over the phone, feel free. I can start with a question.
Okay.
Brandi, maybe you could talk a little bit about, touch on referring to Mama's Neighborhood, but how about the other way around? Can you talk about any scenarios that you might envision where a Mama's Neighborhood clinic might refer to Welcome Baby?
I could think of the situation that I could think of. Can you hear me?
Sure.
Okay. So what I can think of is, from what I understand, and I know nothing is always as concrete in stone, but because our Mama's Neighborhood, the clinic portion of our program, is not a home visitation based like type related service, and it's within our clinic and hospitals, I've known of cases where it is that patients are enrolled in our program with Mama's Neighborhood Clinic, and they're also receiving services through Welcome Baby. And in those situations, some of the patients express wanting to be able to participate in prenatal and education and resiliency classes. And the only way that that's possible is for them to be enrolled in our program. Now, for us, patients can receive services from us. While we would love for them to deliver at our facilities, that's not necessarily a criteria to have services stop. So they can receive services from us and choose not to deliver and participate in Welcome Baby and deliver where it is that they choose at any one of our hospitals. So I guess what I'm saying is, if Welcome Baby services are available at any one of our hospital facilities where those locations are, and since both of our programs deal with patient outcome and want the best for the patients that we serve, those would be the situations if it's available. And if they're receiving Mama's Clinic services, and maybe they've expressed wanting to deliver at a different facility, we could definitely refer, or that would be a time where we could refer.
Okay, great. Another thing I was going to mention too is, I know you have an income eligibility requirement that they must be eligible for Medi-Cal, and there is no income requirement for Welcome Baby. So I was wondering, do you know how, is it often or maybe sometimes the case that women may be declined services or not eligible for Mama's visits because of income, but then maybe eligible for Welcome Baby? Is that maybe a possibility for referral?
Due to income, I haven't heard that yet, but it's not to say that it may or may not be a situation. I could definitely write that question down, make note of it, and get that question addressed for you directly. So you're asking if there's ever a time when it is that a patient would not qualify for Mama's visits, and that they would qualify for Welcome Baby.
Right, like just due to income. If there are certain clients that don't meet the eligibility requirement for mama's visits because of income, that they don't qualify for Medi-Cal. That
Right.
maybe, I was thinking that could be a situation where a welcome baby referral might be an option.
Right. I would probably have to talk to Dr. Jackson a little bit more about that. I do know there's some discussion about different options possibly of payment. If it is that people chose to pay for services, I'm not too sure, so I don't want to give you the wrong information. But I can definitely pose that question to Dr. Jackson and Dr. Salibi and get back with you.
Okay, great. Thanks, Brandi. There's a question in the chat box. What is the income requirements? Same as medical or Medi-Cal requirements? Yeah, I think. Well, you go ahead.
Same as the Medi-Cal. You're right. Same as the Medi-Cal requirements. So if they qualify for Medi-Cal, they qualify to receive services from us.
Does that include share of cost? Do you know?
The share of cost for Medi-Cal?
Right.
I'm not sure, but I can ask Dr. Jackson.
More in the weeds questions. How about anyone else? Any other questions about Mama's Neighborhood or about whole person care or other services that Brandi mentioned?
So we had a question about as far as how moms access Mama's Neighborhood as far as clinics. So in order for a mom to qualify, she has to meet those requirements, but they have to deliver or choose the clinics that Mama's Neighborhood's at. Is that correct?
So I think I got your question. So you're saying in order to qualify for Mama's Neighborhood, the mother would have to be attending, or you're asking if the mother would have to attend those clinics or hospitals where it is that we're offering services. Is that what you're asking?
Correct. So
Okay.
if a mom, let's say if a mom is delivering here at Miller's Children's Women's Hospital, then she wouldn't be able to go to Mama's Neighborhood. We're a little confused on that part.
No, so she would. So if the mother is choosing to deliver, so what we're saying is for Mama's Neighborhood, the clinic portion, okay? For Mama's Neighborhood, patients can receive services through us, whether they, from one of our facilities, so it has to be at one of our facilities, whether they choose to deliver there or not. So even if the mother wanted to go to Miller's to deliver, and if she was part of Welcome Baby and that's where it is that she's choosing to receive those services, she can still enroll in Mama's Neighborhood, the clinic portion that I mentioned in the very beginning, to receive services through us should she choose and benefit there.
Okay.
She wouldn't lose anything, if that answers your question.
It does.
So my next, clarify.
Sorry, go ahead.
Just to clarify what you just said, when you said receive services at your clinic, you are referring to prenatal care at your clinic, correct?
So prenatal care at our clinic, prenatal education. So I'm sorry.
Just the education portion? Yeah, I'm just trying to distinguish the difference between, it sounds like she would be, to receive Mama's Neighborhood, she would have to receive services, but I'm trying to clarify what services are you referring to, like prenatal care, in addition to the support that you give her through Mama's Neighborhood, or just the services that you described earlier that she would get under Mama's Neighborhood?
Okay,
so she would have her own clinic, and yeah, I'm trying to clarify that if you can.
Okay, so let me make sure I understand. So you're saying, say a mom is at one of your clinics or your hospitals, and she also wants to receive services through Mama's Neighborhood. You're asking me, or you're asking, does she have to receive like all the packaged services, or can she pick and choose what it is that she chooses to participate with? Is that kind of like what you're asking? Like, does it have to be all of the prenatal care, or does it have to, if she's getting services from somewhere else?
Right.
Is that what you're asking? So,
from
my understanding, I can definitely clarify, but if there is if she's receiving services elsewhere, like for the example, some patients are interested in the prenatal and education and resiliency services and attending those classes. And they're like, we hear that you guys offer baby items through there, and I'm currently looking for a prenatal education resiliency class to go to, or prenatal education. But I'm currently at St. Francis receiving my care. She could still enroll in Mama's Neighborhood and participate in that portion of services that we offer and go back to St. Francis if that's what she chooses. So I guess in essence, what I'm saying, we're not necessarily trying to steal patients away in any kind of way from wherever they are. We definitely want to be an option and to be able to enhance what it is that they may already be receiving. Should they come to us and want to receive everything from us, that's definitely an option. If they're someplace else and want to receive portions, I believe that's an option as well. And they can still stay where they're at.
Steve, I have a question. It might be geared more towards you. And I also, for Mama's Neighborhood, do you guys have outreach specialists yet involved with your program, or is that something that's still in the talks, or will there be outreach specialists for your program?
So are you? I'm sorry. Were you asking Steve, or are you asking?
The outreach portion was towards Mama's Neighborhood, and I have a question for Steve afterwards. Sorry.
Okay. So as far as, remind me so it is that I can answer correctly. Your outreach specialist, so we have care coordinators, but I want to make sure that we're not doing the same thing exactly in reference to what portion of the job are you asking about. So outreach specialist is in, what do you do specifically? And I can tell you if we have that here or if we have various jobs that overlap with that. So just tell me a little bit about what you do.
That's a great question. Steve, would you like to take that? Thank you.
Sure. Yeah, I guess, Brandi, Mama's Neighborhood doesn't have outreach specialists per se, but I know that you do outreach and marketing, right, because we've worked on some of your materials and getting some of those printed.
Right.
So just to get back to what outreach specialists do, the point is to do outreach and to enroll clients prenatally through a variety of different areas. I mean, everybody on this call would probably do a better job of explaining their own job than I would, but just to give it the quick summary, Welcome Baby outreach specialists do prenatal enrollments and referrals for the Welcome Baby program. And the focus is on prenatal enrollment, and it's done at provider offices, through maternity tours, at WIC offices, and clinics. So I guess what Curie is probably getting at is, are there those who go out to provider offices and clinics and sort of pitch the Mamas program to pregnant women in the lobbies and try to develop relationships with providers to refer clients or their patients to Mama's Neighborhood?
Okay, so I better understand. Thank you for the clarification. So to answer that, I'm going to answer it in pieces. So the unique portion of our program is, so if you guys are going out as outreach specialists to make the connection with the providers, like at different sites, to link your clients to care, the unique portion with our program is that everything is in-house for us. So LACUSC, those doctors that are there, that are servicing the patients, Mama's Neighborhood is there. So it's not really for us going out to make the relationship with the provider, because it's part of the services that are provided. It's all like in one place. So LACUSC is on board. We don't have any private hospitals. Since we're LA County, ours is all of the county birthing hospitals and facilities in LA County. So that would be LACUSC, that would be Harbor UCLA, all of you, MLK, at least MLK is not one of the birthing hospitals, but one of our outpatient like type clinics. So the relationships for us are in-house because Mama's Neighborhood is just part of the services that we provide like already. So we don't necessarily have to outreach to providers that way. They're already in, if that makes sense. Now, as far as prenatal enrollment and referral, our care coordinators are the ones that do a lot of the patient intakes and the referrals. So outsourcing or providing resources to patients, whatever that may be, whatever it is, type of assistance that they need help with, our care coordinators do that. And they also work on enrollment. They're enrolling patients that are incarcerated in the jails. They're enrolling patients that are in our clinics and or our hospitals. And a lot of our staff, whether it be health educators, health education assistants, a lot of our health education assistants that work with us do a lot of the sitting in the lobby outreach, trying to get word out about our classes or tell patients about the services. So it's not necessarily an outreach worker per se, but some of those jobs are spread across the responsibilities that our current staff already has, and it's more of an in-house thing where we it's like building the relationship within type thing, unless we're going outside to partner with other agencies. So we do go outside and establish MOUs with outside agencies and partners to help with maybe some of the gaps of care that maybe we have or outside of the services that we provide. So it is that we can make it more of a continuum of care for patients. So I don't know if that answered completely, but I hope that gives you a little bit more insight, and let me know if I can say something else to clarify.
So you answered the question well. My thought process is, I guess the second part would be more towards Steve in reference to if we were to reach out to a mom. I know that moms can't double dip, so they can't be in either programs. It has to be one or the other. Would there be a way for us possibly to, I guess, streamline that through the database where if we and our mom and we find that she's in Mama's Neighborhood, that we would know? How would we know besides asking her? Because a lot of times we have clients who are unsure of what home visitation program they're in because there's so many that they might, forget that they're in Welcome Baby or in HFA or in Mama's Neighborhood. So is there a way for us to help streamline that so we can filter it better?
Okay, so from Mama's Neighborhood, so Mama's Neighborhood, remember, is like an umbrella. And Mama's Neighborhood has portions of its program. So not all of Mama's Neighborhood is Mama's Visits, meaning not all of Mama's Neighborhood would be off like limits for you because it's not all home visitation. So just because a patient was enrolled in Mama's Neighborhood doesn't necessarily mean that she's in the Mama's Visits portion where she's receiving home visitation services. I think that's where the double dipping thing comes in. But if it's Mama's Neighborhood clinic, and if you ask, is anybody visiting you on the outside, and they say no, and they tell you the services, then you would know. Like, that's the designation. So I think,
thank you.
Yes. Mhm.
Yeah, thanks for bringing that up, Carrie. That was a point I wanted to mention too. There is, as you say, no double dipping, but as Brandi explained, there are plenty of options with Mama's Neighborhood that a mom or pregnant woman could participate in and still then be enrolled in Welcome Baby. I wanted to mention, I did say that we have produced materials for Mama's Neighborhood. We've been handling the printing for that. And along with that print order are lots of Welcome Baby flyers as well, so that the word can get out, Welcome Baby, in the Mama's Neighborhood clinics as well.
Mhm.
But as show that a client's enrolled in Mama's Visits, it's just, as you said, Brandi, you just have to ask, I guess.
Right. Now there's no system. I guess we don't have a system available where we talk to one another because you guys wouldn't have access to Orchid, like, or a way to look that up for clients.
Right, right.
Mhm. Now
Yeah, I
I
guess
know
the
what.
main. Oh,
Uh-huh.
go ahead.
I
Go
was
ahead.
going to say, I know for a lot of the agencies that we partner with, we have different levels of partnerships. Um, Angelica Campos is the health educator that handles kind of like all of our MOUs, but we do have some available where it is that there's like different tiers. And the tier 2, 3 is like where it is that PHI is exchanged, like there's different levels. So it depends if that's something that you may be interested in finding out. There may or may not be a way for us to be able to share that information with you. Um, I'm not sure. But for right now, I guess, like you said, it's a lot of asking the patient um, what types of services that they're enrolled in or what types of services that they're already receiving.
And then just to reiterate the importance of, I think the point that just because a mom says that she's involved with a Mama's Neighborhood clinic doesn't mean that she can't enroll in Welcome Baby. It's just that she can't be receiving the visits. So whole person
Right,
care programs that you mentioned, those are, those are fine for someone who is enrolled in Welcome Baby.
right.
All right. Do we have any other questions for Brandi? Anything else you wanted to cover, Brandi? Do you have any questions for us?
Um, I guess maybe for me, a question that I had for you guys with looking through your materials to kind of see about that overlap and who could enroll, who couldn't enroll, that kind of thing. When you talk about your first 5, what is it, your best start communities? And I see that you say that families or patients or clients have to be part of those best start communities in order to enroll or receive services. And if they're not, there may be certain services that they're not receiving type thing and like it's full capacity. Um, do you have a lot of clients or patients that aren't in your in those cities, like to be able to receive the full scope of your services, the communities, the best start communities?
Hi,
Yeah,
I
the
think
short
this
answer
is Anna.
is yes.
Can I just add on really quick? This is Anna. I'm with Maternal
Sure.
and Child Health Access. We work
Hi,
with
Anna.
California Hospital. Hi.
Okay.
So the out of the 14 hospitals that offer Welcome Baby, California Hospital and Maternal Child Health Access is not limited to just enrolling Best Start clients. We served up to about 72 zip codes surrounding California Hospital,
Okay.
zip codes that are within 5-mile radius to California Hospital. So we do have this one. We were the pilot program, and we were able to keep our geographic area broad and are not limited to just a Best Start community, although we do have the Metro LA Best Start community within our service area.
Okay.
And to answer your question, I don't know if Steve probably has more to add on, but what I was thinking is, because we're working very specifically with providers that are delivering at our participating hospitals, and most of our programs are in-house they work inside the hospital, so they're working for that hospital and they're recruiting, we're outreaching patients that deliver there. And some of us, like MCHA, we partner out with California Hospital, so we have an interest to reach out to women that deliver at our hospitals. The opportunities, and there are opportunities, where we may come across women that are not within a BISTAR community or are not within our 72 zip codes that we covered at MCHA, and perhaps do not want to deliver at our hospitals, or maybe are delivering at our hospitals but could be referred to Mama's neighborhood or Mama's visits.
Okay.
So I think that from my experience, and the other outreach specialists can speak to this, I haven't necessarily come with a large number of families that could be referred to your program, because I thought it was limited. They had to really pick one of your healthcare. They needed to pick a DHS provider for their maternity home. But given that that's not the case, I think that can kind of opens up the opportunity to refer. As long as they're not, and with us, because we work very closely with our clinics, we have to be very mindful and careful that we're not introducing a whole new system of care for them, and now our provider, our partner, is losing a patient to so we have to. Yeah, we have to be very careful how we address it with our own clients, but definitely those clients that don't fit into our service area or a BESTAR community can definitely be referred to Mama's.
Right, we appreciate that because we do definitely service all zip codes as long as it's LA County. So for us,
right, and that's the benefit. That's one of the you serve a much broader area. Yeah.
Right. But like you said, even for us, I know looking at your list for Welcome Baby, Martin Luther King is one of the sites where it is that we see. So Martin Luther King Hospital is not a county facility, although it's a little confusing. So although the Martin Luther King outpatient center is like where people would receive prenatal care and our services, not every patient, some are eligible to deliver at that hospital and some are not. Those that have high risk, like related situations, are usually, if they're there at MLK, are referred to Harbor UCLA Medical Center. So probably for us, even if patients are high risk, or there may in some cases sometimes be facilities that don't necessarily deal with like a lot of the higher risk situations, as in that case, like at MLK where they have to be referred to another facility. That could definitely also be an option if it's more complex and wherever they're going don't necessarily cater to or address that. Not in all cases, but sometimes that does happen too. We've seen that. We're definitely not trying to pull away or steal, but we're trying to enhance and work with and provide patients with as much as we can to improve their outcomes.
And it does serve, it helps close those gaps.
Right.
For sure. Yeah.
Right.
Absolutely. Well, thank you.
Yes. Thank you.
All right. Well, Brandi, thank you so much for taking the time and giving us this thorough overview and explanation of all the services. I hope everyone enjoyed that. I think it was a great presentation. Thank you so much for.
Thank you. And I think I saw something pop up really quick about all of you.
I have a question.
Oh, there you go. Okay. Yes, I can hear you.
I did hear you mention Lancaster and Palmdale, but while scrolling down the list, because it was just too fast for me. Is Olive View the closest location that meets the Mama's neighborhood requirements? For example, because we do receive a lot of mommies that don't qualify for our program. So where will we refer them to? Where will be that clinic that they'll basically go to? The closest to the Antelope Valley.
Right now, I believe our facility is Olive View Medical Center.
Okay, because that's pretty far away from the AV.
Right. Now, depending, we do have our Mama's Visits that's in AV. They're in Lancaster, so they're in Spa 1. They're in Spa 2. So depending, what you could do is, even if you're unsure, that's okay. refer through the refer through the portals that we provided, and we can present that feedback to you. It could be that the clients are eligible for mama's visits, and it
Okay.
may be that we can have somebody going out to them.
So the care coordinators will be local.
Right, the care coordinators,
Okay.
the public health nurses, and some of our psychiatric social workers. So even if they're not local, they service that service planning area.
Okay.
So they know
Perfect.
where they are. So that could most definitely refer them, and we can see what we can do and how we can work with them.
Okay. Thank you.
Thank you.
Yeah, thanks, Christina. Didn't mean to cut you off there.
Oh, no, you're fine.
All right. All right. Well, if there are no more questions, we can wrap up the webinar portion here. And again, a big thanks to Brandi. If there are other questions, pass them along to me. I think, Brandi, we can send the slides out as well after in a follow-up. And
sure.
We also have. Oh, sorry. Just going to say we also have some of the marketing materials I mentioned. We can include the Mama's Neighborhood flyer along with the slides here, which have your contact information.
Yes, and I also included in the slides, you'll see, for those of you that are in different regions and spas 1 and 2, wherever, we do have the health educators that you can also call there. And I took down notes for the questions that you had, so definitely, Steve, if it's okay, I'll take some of those questions, try to get them answered, and get them out to you maybe for you to be able to share with the people that were on the call.
Fantastic. Yeah, that's great. Thank you.
Okay, thank you.